Good morning, gentlemen. How are you?
Good morning. Good. Thanks for having us, Kevin.
I'm glad to have you with us today on the Patient's First Mission segment. I look forward to these segments because I always learn something new or get some great tips or advice or something. I always get something out of our conversations that I have with you guys and the folks over at Excel Rehab and Sports. And today, it's going to be a beautiful sunny afternoon, and it's a day made for folks like our events coordinator here in Seneca, Mr. Riley Johnson. He is an avid runner, and I know there are a lot of people who are going to be taking advantage of the weather today, getting out and enjoying a run, but there are a few things that they want to think about, like getting hurt, right?
Yeah, that's right. Yeah, especially coming out of the winter months. If you're like me, I'm a runner myself as well, but I do a lot more indoor work and less long runs during the winter. So it's time that we see a lot of people starting to get back out and ending up with some lower extremity injuries that they maybe weren't expecting when they planned on either getting in shape or starting to train for a race.
Yeah, exactly. So, I mean, you don't want to just jump up off the couch after being in quarantine and coming out of the winter and just start running, right?
That's exactly right. I mean, so one of the things we want to talk about is kind of injury prevention for runners, and there's kind of some myths in this area that, or just things that people do a lot of that aren't near as effective as you would think they are, and then some other things that you wouldn't think of as much that are kind of the most effective things. The thing I hear the most, if I were to ask somebody, what is the most important thing you can do to prevent injury? Usually within runners, usually the first thing you hear is something like stretching, wearing just the right shoes with the latest technology, wearing some compression socks, foam rolling, that kind of thing. I'm sure you guys have, heard people talk about or have used before. And those are, if I had to say what those amounted to, not that they aren't good or effective, but they kind of amount to sprinkles on top of the cupcake. They're nice, if they're there sometimes, but it's not what you come to the party for. So those are kind of a small percentage things that don't actually, they may make mild effects, but aren't the big proven preventers of injury for runners.
Well, what Austin or Jeremy, what are some common injuries that you guys see that affect runners? I mean, we hear of things like bone spurs and blisters. I mean, those are pretty common. But what else? I mean, ankle, knee. You've got a lot of stuff, a lot of factors to consider there.
Definitely. So, yeah, or you go ahead, Jeremy.
No, I was just going to say a lot of the stuff we're dealing with. We call these, these are the endurance athletes. So these are much different than our football injuries that are, potentially a single event that occurred and created a damage to a tissue. These are more of a repetitive overuse type thing. So there's all kinds of things from, shin splints to bursitis and IT band syndrome and all kinds of things that go along with that. I'll let Austin speak more. He's our running expert, and we try to send as many of our running injuries over to him at his clinic as we can just because of his expertise in this. But I'll let him speak a little bit more detailed on the specific things he sees a lot of.
Sure.
Yeah, definitely. So I think the biggest two that I see with people, especially when they're starting back or kind of ramping up into a new training program, are shin splints and some different knee pain issues, that whether that's IT band syndrome or some anterior knee pain that's kind of under the kneecap. And then closely following that would be like tendinitis, either in the knee or down around the ankle. Those are big ones where your tissues just haven't adapted to the level of load that you're putting on them when you go straight from sitting on the couch or not doing as much to maybe the level of training that you were doing a year ago, or just kind of ramping up too quickly. But those are the biggest ones that I see that are stopping people from running the most.
And, somebody comes in, they've got shin splints, they've got something, one of those injuries that you've mentioned there, Austin. Somebody comes into an office over at Excel. I know that you guys are going to approach it, according to each patient, because that's how you roll over there. You treat each patient individually. The care is custom tailored, I guess is kind of the phrase I'm
Absolutely.
looking for. And I know that there's a lot of hands-on, but what are some things that folks can do? What are you telling people when they go home? I mean, because there's a lot of stuff like aftercare that you're going to have to do, and people don't want to just prop up their leg and wait on running. I mean, especially, the folks that are really into running that want to do it every day. They're stubborn, I guess. They want to run through the pain, and that's
Absolutely.
not always a good idea. I mean, you can make things
Absolutely.
worse.
I think the hardest thing to ever do is to tell a runner not to run. So
Yeah.
I do it as little as I possibly can. And whenever I do, I'm always replacing it with something really intentional. The biggest thing, I think, as far as either treating an injury or injury prevention, is with runners, actually between 60 and 80% of all running injuries are due to a training error. So you did too much of one type of workout. You ramped up your mileage and intensity too quickly. So my biggest conversation on day one, probably with about 60 to 80% of the running injuries I see, is just really diving into your training. Hey, did you hop up and jump right into the middle of a Couch to 5K program without proper buildup, or did you sign up for that 50K crazy ultra trail race when you've hardly ever run more than a mile before?
Yeah.
And then there's a lot more specific stuff that we won't get into that can play into that. But that's kind of the importance of working with somebody who is familiar with running and kind of has some level of specialty in that field, because that training has to be addressed.
Yeah.
Yeah, Kevin, if I could interject here too, I'd like to throw Austin a question myself, or speak to a little bit more. I think one of the things that we commonly hear, and maybe it's changed. I'm an old dog. I've been doing this a long time, but very commonly the perception for runners was you don't need to weight train because it'll add muscle mass. You don't want any extra load on the joints when you're running. And strength training is really important for these guys so that their conditioning can be, so these tissues can be ready for the loads they're going to put through that. Austin, I don't know if that's still the research that's saying that, but what's your thoughts on strength training for these guys?
Absolutely. I think that, and more research keeps on coming out that continues to strengthen the idea that these people need to be lifting weights. They need to be doing, at the very least, some body weight strength training. I would say that, and I looked at saw a study recently reviewing various injury prevention things, and they said things like stretching might be 5 to 10% decrease in injuries, while strength training, engaging in a strength training program, could decrease your injury risk some 60% or more. So that is really the mainstay. All the time you hear runners say, well, or especially female runners, oh, I don't want to get bulky. I do this so I can, stay in shape and watch my figure and things like that. I wouldn't want to lift and get bulky or carry around extra pounds and stuff like that. And that's just absolutely false. You're not going to get bulky just because from the kind of strength training we're talking about. But, yeah, the tissues aren't ready. I mean, you got to think of running as a series of hundreds and thousands of single leg hops. Your tissues have to be ready for that. It's no wonder people get, tendon injuries and things like that. If you aren't loading your body and preparing your tissues for that, you're not going to wear your joints out because you did strength training. Right. Research shows the exact opposite. You actually preserve your joints by using them in that way.
Yeah.
So, yeah, strength training is a very close number 2 and up there with just the actual training plan you follow as far as preventing injuries for runners.
Now, what about people who are just starting out running? Obviously, it's take it slow, take it easy, don't bite off more than you can chew. I mean, that's obvious, but what are some tips that you would give them as far as preparing to run, stretching and things
Absolutely.
of that nature?
So I would say the biggest thing is finding a trusted either coach or program to follow. Not everybody needs an individualized coach, but there are tons of resources out there. Pick one that's well respected and you can even have your therapist or whatever professional that or you in that area look over it and make sure, hey, this isn't ramping you up too quickly. If you haven't ever run before and you've heard that, even like, a goal of mine is to do a marathon. The first run you train for should not be a marathon. It should be an easy 5K, and it shouldn't be next week. It should be in a few months. Yeah. So the biggest issues when it comes to starting out are ramping up too quickly. You should expect some aches and pains that you weren't expecting or that are new to you. But if you're ramping up in a slow, methodical way, following a good, well-reviewed program, then you should be able to decrease any injury risk. But I would say follow a program or work with a coach. Don't just go out there and say, well, let me see if I can run 6 miles.
Right. I imagine that's something that you guys, if somebody wanted to reach out to Excel Rehab and Sports, you could probably help them with something like that, couldn't you?
Yeah, that's right. And Kevin, what we'll do is we'll talk a little bit more offline when we get done with the call and see if we can't post some helpful information to our social media accounts when we get done with the call, so people can go and pull up some good Couch to 5K programs or something along those lines as well. So we'll put some resources out there for folks.
Absolutely, and we'll be glad to share that over on our Facebook page and our website, 941 The Lake, and 941thelake.com. Guys, have we missed? Are there anything that we want to anything we want to pass along this morning that we might have missed for the runners in the area as they get ready to enjoy this weather today?
I was going to say one other thing that's a good rule that anybody can take away and apply to a plan that you're looking at or anything like that is what I call the 10% rule. Once you get more than 10 to 15 miles per week in your running program, you shouldn't really be increasing your mileage more than 10% each week. That can seem really slow to some people, but that's a surefire way to keep yourself from getting an injury that you wouldn't get otherwise. I think that's a good takeaway.
10% rule. Now reiterate that again, Austin.
Yeah, so basically, if you run 20 miles last week, you shouldn't be running 30 miles next week.
Right.
You can ramp it up to 22, but no more than that. And that's only if you feel good, rested, and you're not feeling an injury beginning or something along those lines. So no more than 10% increase in your weekly mileage, considering that being spread over a few different runs.
Absolutely.
And Kevin,
yes.
I'll add to that. You mentioned earlier, I was thinking when you were talking about beautiful weather and it's springtime, every year we tend to go through this, and competitive runners like Austin and several others out there do indoor training programs. Casual runners like myself tend to eat too many desserts at holiday meals. So,
yeah.
A lot of folks are jumping into it again in the spring. And for some folks, it's an annual return. And with COVID last year, a lot of our events were canceled. And I know a lot of people will sign up for a race as motivation to train. I hear patients say that all the time. That if they have an event to look forward to, then they will get out and run more. And a lot more events are coming back online this year. Matter of fact, we're sponsoring one in a few weeks here. Or we're teaming up with a group here in a few weeks in Chattanooga to work that race in early June. But I think one of the big things that we have to be mindful of is as these things are coming back online, people are going to start training more and more. And more than likely, we might see more of that this year. And what we can do in therapy, you mentioned earlier about stopping running. Well, stopping running is not going to be the solution for a lot of folks, especially if you're halfway into a training program for a race that's coming up in 6 weeks, 4 weeks, and now you've got a tissue breakdown what we want to do with you in therapy is to find a way to continue your training. Like Austin said, take away something but replace it with something else to keep your training moving forward so that you can continue that event. Occasionally we will have to say, it's just not safe to do that.
Yeah.
But for the most part, we're going to do all kind of things in therapy, like using taping to offload certain tissues so that you can continue to train, and different training changes that we can do. So if you're in the middle of training for an event, you're suffering, you're starting to develop some breakdown or some pain, give us a shout. We got free screenings available. We can work you in usually same day and take a quick look and see what's going on, and see if is there anything we can add to it. Dry needling is one of those things that we do for runners quite often, which is extremely helpful to shut down hyperactive muscles and get things back in line so that they can continue to train and meet their goal to run the event.
That's something that actually helped my mom with her hip when she had it replaced, was needling. She was talking about how much it helped. And I said, well, what is that? Of course, I had no idea. It's an amazing tool that we use, just like anything else, but it's just an amazing job of shutting down hyperactive muscles. And for runners especially, because it's so effective and it's so quick that it can get you back on track to training much faster than just about anything else out there. And not just runners, but practically any sports-related injury or injuries in general. You guys can get people back in motion very quickly over there at XL Rehab and Sports. Jeremy, you've got offices in the upstate here in South Carolina, in Clemson, Easley, and Seneca. 864-654-2001 is the number in South Carolina. And if you're in the Chattanooga, Tennessee area, look for their clinics in East Brainerd, Hickson, and at North Shore. Give them a call, 423-254-5461. Jeremy Shook, Austin Kercheville.
Got it. You got it.
Better late than never, right? An ounce of prevention is worth a pound of cure, but if you need that pound of cure, XL Rehab and Sports is for you, and there is a difference. Check them out online, xlrehabsports.com, and find out why there's a difference. Jeremy Shook, Austin Kercheville, thanks, guys, for joining us today on the Patient's First Mission segment.